This is Boomer Life on CL 650.
Welcome back to the program. On the program today, we're talking about the very special health category of varicose vein therapies. Our guest is Dr. David Liu of FalseCreek Healthcare Center and the Eva Vein Care Clinic. And we'll give you both those website addresses a little later on. We were going to have you talk a little bit, Dr. Liu, about, because you've marveled a couple of times already at the amazing array of technology you have at your fingertips at FalseCreek Healthcare Center and the work that you and your team do with this, the vein therapies and so on, requires very, very much state-of-the-art equipment. So tell us about some of, because you talked earlier about back in the day, we had this cookie-cutter approach, and you had one of, we could deal with 3 or 4 different types of varicose veins or vein issues. And if you presented one of those 4, well, we could take care of you in our own unique way. But that was it. And if you had anything other than the 4 that we were capable of handling, well, we didn't do a very good job. So now, times have changed. You've described at great length the nature of the changes. So tell us now what people, what sort of equipment and technology you have at your disposal when someone comes to you, perhaps as we talked about a few minutes ago, looking at some kind of cosmetic issue, a little spider vein that they think is nasty looking and I'd just like to have that removed. And then you go in and you start testing because you're not satisfied necessarily with the patient's diagnosis. That's your job.
Sure. The way I like to think about the diagnosis and treatment of venous disease is by thinking about the veins in the leg as a tree that's flipped upside down.
Right, right.
So a patient may present with a single leaf, a small spider vein that may be an isolated problem, or it may be a reflection of a more central problem, the trunk of the tree.
Right.
So if I trim that leaf off, that may not cure the issue, or cure the problem. So one of the most important things that we do at Eva Vein Care is ensure that we do the full diagnostic battery, including clinical history, physical exam, and using the latest diagnostic tools like Doppler ultrasound, power ultrasound, near-field polarized lights, and lasers to be able to identify the flow and the pattern that's unique to the individual.
Okay.
It's only at that point in time that we can really start taking a look at the treatments that are available, because there are a lot out there, and it's a matter of trying to navigate through and personalize the person's treatment plan with the equipment that we have to implement.
You talked about ultrasound, which back in the day used to be sort of the exclusive domain of the gynecology set, as in helping to determine the health of a growing baby. Now, in medicine across the board, ultrasound is a very much used tool. How do you use it in vein therapies and treatments?
We use the ultrasound in vein therapy and treatments to map out the anatomy and also to map out the blood flow patterns. There are different types of ultrasound. One in particular that's very important, referred to as Doppler ultrasound. Now, a Doppler ultrasound basically is able to measure the direction and the velocity of flow. And the best way to describe it is if you hear a train coming at you with its whistle coming towards you, the pitch increases, and then when the train goes past you, the pitch decreases.
Correct, yeah.
That's the Doppler effect.
Okay, okay.
And we use that with the ultrasound probes to help measure the velocity and direction of blood flow in order to be able to identify the highways, the signs, the on-ramps, the off-ramps of the vascular map of your leg. And with that, we can then identify where the problems are. We'll call them the traffic jams or the diversions, or where the bridge basically is only halfway done and the car falls off the side.
Okay.
And once we understand that entire roadmap, then we can start looking at the advanced therapies and treatments that we can offer. There are a lot out there. Some of them are better at certain situations than others, and that's why we're very fortunate to have such an expert team at Eva Vein Care, because we literally have all the tools and facilities at our fingertips to be able to find the best treatment strategy for the individual based on that map.
And back in the day, it was pretty much a given that if you had varicose veins or other vein issues or venous issues, there would be some surgery. And as you've described it already, some of it pretty aggressive, pretty invasive. And your partner, one of your partners on your team, of course, is a vascular surgeon. But you're saying that now, if there are surgical procedures required, they are minimally invasive. How is that accomplished?
That's correct. So The traditional type of surgery that was done up until about the late 80s, early 90s is referred to as surgical ligation and stripping.
Yes, I've
And
heard stripping. Yes, literally pulling the vein right out of your body, right?
that's right. It's literally extracting the vein out of the body through a series of incisions and manipulations. It is a very aggressive type of surgery. It does require several weeks of recovery, and the efficacy of it is somewhere within the high 70s to mid 80% range.
Okay.
Ultrasound has improved that a little bit. What we do now is instead of taking the vein out from the outside, we actually close the vein down from the inside. So what we can do are what are referred to as endovenous procedures, where we use the ultrasound again to put a very small wire in the varicose vein, navigate that wire all the way up to the top of the leg, and then use a series of different types of treatments to literally either close or burn the vein from the inside out, so that it gets eliminated in a way that the body resorbs over time as opposed to physically removes.
Oh, so you don't actually remove anything. That what you just you destroy its functionality, and then it just essentially evaporates. And I know that's the wrong word to use, but it just, once it ceases to function, it just goes away.
Correct. So the body actually
Isn't that something?
the body actually creates a temporary inflammatory reaction, which then resorbs the vein. Just like how if you have a cut on your skin, it heals over time.
Sure.
Once we create the damage on the endothelium, or the inside layer of the vein, it will actually close down, and the body will eventually resorb that over weeks to months.
Because and I'm curious now, it's just a straight curiosity question, because the issue of, especially the cosmetics of varicose veins, it's always been an issue for particularly women, but the remedy was aggressive and surgical and iffy. But I'm wondering, because you have these new minimally invasive procedures, has the demand for your services, because there's not as much cutting going on, is the demand now higher because it's safer I suppose in many ways safer?
Absolutely. We find that there's a lot of interest when people become educated over the options that are available, and oftentimes they'll choose that endovenous options for a couple of different reasons. For men, typically it's because they either have severe symptoms or they don't want downtime.
Right.
So, for instance, we've had men who are ultra marathoners who literally don't want to take more than 2 weeks off training to be able to get back on the road. We've had physiotherapists.
And you can have a vein discontinued in your leg and be back out on the marathon circuit in less than 2 weeks?
Absolutely.
That's amazing.
We've had physiotherapists that want to get back to work that afternoon that we've been able to treat effectively. So we treat them during their lunch hour or during the morning, and they go back to work in the afternoon. We've also had women that have wanted to go to the debutante's ball in the evening and wear skinny jeans and high heels, and we've been able to offer them a treatment so that they can be treated on that day and still be able to fully function by the evening. This compares to the traditional surgical stripping and ligation, where you're typically
You were down for the count for weeks, right?
2 to 3 weeks is typical.
Yeah.
That's right. So really what we're trying to do is get people active, get them up and about, and decrease literally the pain threshold to having undergo these treatments, because the sooner we can treat, the better the results and the easier the procedures are for our patients and clients.
And again, we've talked about the reluctance of male patients to come forward and seek medical opinions and advice, but even reluctant guys have to be impressed with the ability to diagnose and prescribe therapies or treatments or remedies in such swift ways now relative to the way it used to be.
Absolutely.
It's amazingly fast.
At Eva Vein Care, we really strive to be able to put a management plan together for our patients the day that they come in for their assessment. We spend a lot of time really dedicating ourselves to understanding that person's health, as well as understanding their expectations,
right,
in addition to those advanced diagnostic tests like I had mentioned before, so that we have a very clear view of what we can do and how we can do it.
Right. If a person has a varicose vein issue, but they're on some kind of a chronic med management program, blood thinners or something like that, does that affect your ability to deal with their complaint about vein issues?
It all depends on the medication, but that's also part of the intake process to better understand that person's overall health. If the patient is on anticoagulation or certain medications that may potentially cause risk to bleeding or to blood clots forming, we have the experience in the EVA team to be able to modulate or correct those medications, at least temporarily, to be able to treat the fundamental problem. We do it on a fairly regular basis, as we all know. Disease processes exist not in isolation, but usually in groupings.
Right.
And we're fairly comfortable with that. And if not, we do what we can to make sure that we have the right experts on hand to provide us with the proper advice.
Interesting. Our guest is Dr. David Liu from EVA Vein Care and FalseCreek Healthcare Center at 555 West 8th Avenue in Vancouver, and online at FalseCreekHealthcare.com. And we promised you would also give you Dr. Liu's website at EVA Vein Care, and it is EVAVeinCare.com. And EVA is EVA. Vein, V-E-I-N, care.com. All one word, EVAVeinCare.com. We'll take a quick break, and we're back with lots more on Boomer Life here on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.